we're coming now to Dr. Yara Asi, who is a post-doctoral scholar at the University of Central Florida, where she's taught in the Department of Health Management and Informatics for 6 years, and her research focuses on global health and development in fragile and conflict-affected populations. And I note that you were the Fulbright Scholar over the last year in the West Bank. So over to you, Yara, and I apologize for that interruption.
Thank you for the introduction. It's a pleasure to be with you, everyone. I'm Dr. Yara Asi, and thank you, of course, to the Council for having me. So depending on where you are in the world today, more than a year after the World Health Organization declared a global pandemic, your experience of this coronavirus is quite variable. So where I am in the US, you could go outside today, and aside from some residual mask wearing, not even that much, you would not notice that much is very different at all than it was in the beginning of 2020. Other parts of the world, however, are experiencing third and fourth waves of infection and are doing quite poorly on vaccination rates. Most of these factors are completely unrelated to an individual's behavior, and they're more so related to factors of governance and economics in each state prior to the onset of the pandemic. So those of you watching this talk are aware of the vast diversity between the nations of the Middle East, from their size to socioeconomic status, level of development, and so on. So today, for the sake of time, as I talk a little bit about the health situation of the region, which is what I'll be focusing on, rather than go through the states one by one, I will talk about them in three relatively loose groupings. So one will be the conflict affected and most fragile states in the region: Yemen, Syria, Iraq, and the occupied Palestinian territories. Two will be the middle income and, let's say, relatively stable nations like Jordan, Lebanon, Tunisia, and Egypt. And three, of course, the high income states of the Gulf like Saudi Arabia, Qatar, and Bahrain. Then I'll end with a broad overview of the challenges the region faces in a post-pandemic world that we hope is coming sooner rather than later. So first, let's start with the region's conflict-affected states. These are, of course, the states that are least equipped to tackle something, a major societal disruption like a pandemic. Their population is already typically at a health deficit because they're poor, they're underserved, they're water and food insecure, and they're generally lacking the components of what we would consider a healthy life. And this can be something as basic as consistent electricity. They're more likely to live in dense urban areas and cramped refugee camps, which makes social distancing impossible. And with high poverty rates, anyone who did have a job could not afford to stay home from work, even if they were sick. Due to limited international travel and movement restrictions, for example, the blockade in Gaza, of course, these countries were among the last to report positive COVID cases. However, we also have to take into account that they also had fewer testing kits, functional laboratories to test the kits, and available health personnel to do all this work. So it's difficult to trust some of the data out of these countries, but as reported, Yemen was the last country in the region to report a COVID case. These countries faced really difficult choices during the pandemic. They had to shift already scarce health resources to treating COVID patients. Of course, other health ailments don't stop in this time. They also understandably report low institutional trust, which reduces their compliance with state mandated recommendations like masks, social distancing. And unfortunately, we're seeing this with vaccine hesitancy in a lot of these countries today. In Iraq, for example, just around 1% of the population is estimated to be vaccinated. These countries will need significant support post-pandemic just to return to a pre-pandemic baseline, let alone to be able to attend to the root causes of their protracted conflicts. So next we'll turn to these middle income states, and these are the most diverse in the region. It's not a perfect grouping, including in their current reality with COVID. Most of these states, surprisingly, were able to get away with only a few cases in the spring, and a few even managed to have a decent summer with only a mild and short first wave as they engaged in strict lockdown measures. Yet by fall, and especially by the past winter, most of these countries were experiencing high infections along with what you don't want to see, which is high hospitalizations and death rates that were straining their healthcare resources. The ministries of health in these states are notoriously underfunded, especially in areas of prevention and health promotion. Funding for health decreases as defense and security spending has continued to increase. This has brought even the most stable of these countries to a really desperate place. Tunisia, for example, despite its level of development, has reported the highest deaths per capita of any country in Africa. Today, we're also seeing significant diversity in terms of vaccination rates. So you look at Jordan, which was also the first country in the world to vaccinate their refugee populations, they've vaccinated 15% of their population. Now, compare this to much of Europe and the United States. This is not very high, but let's look at Egypt, on the other hand, which has just vaccinated about 2%. Long term, it will be important to watch how these countries rebuild their health systems as well as their economies, as COVID has really stalled any growth that was happening and increased poverty. We'll also have to watch for democratic backsliding after a year of increasing government control and surveillance. So, lastly, let's address these high income Gulf states and how they fared during the pandemic. So it's no secret that these countries are generally very rich and highly developed with, fancy new architecture and modern comforts that aren't seen in many other parts of the region. Yet what may be surprising is that their health systems are not considered high functioning, despite most of these countries offering universal health care to their citizens. Public health investment is actually very low. These populations report very high levels of obesity, high smoking rates, and a lot of indoor activity due to the very high temperatures in the Gulf. These are, of course, ideal conditions for high risk COVID cases. And indeed, some of these countries, like Bahrain, have reported death rates much higher than their less developed neighbors. When COVID struck, large investments in the health sector were made, but this is the type of situation where preparation is much more effective than quickly trying to make up for lost time, no matter how much money you have. At the same time, oil prices, which bolster the economy of this part of the region, collapsed. Now, I know another speaker will get into the economic effects, but this caused a crisis for the rulers of these states that pulled focus and resources from the simultaneous health crisis that was happening. While the citizens of these countries were able to engage in lockdowns and other measures, the laborers building the infrastructure of these countries, who often live in crowded and unhygienic labor camps outside of the major cities, could not. And it's important, I think, to remember these people when assessing the success, quote unquote, of these countries with vaccination. When it comes to vaccination, these countries are doing extraordinarily well, with most having vaccinated at least half of their populations. And in fact, the UAE specifically has the highest per capita vaccination rate in the world. So I want to end with some broad perspectives. First, regardless of socioeconomic status, COVID has made clear that the health systems across the Middle East are lacking. This is a highly militarized region with high levels of corruption and poor responsiveness to citizens' needs. The benefits of investing in public health are not always immediately clear, which makes them less attractive to leaders on short term timelines or who are only out for self enrichment or self preservation. Yet it will take years for the Middle East to dig its way out of this past year. Another health shock, which is not impossible, as we saw with MERS just a few years ago, would be devastating. A fundamental restructuring of how public funds are spent and what should actually be considered national security is needed. And unfortunately, I'm not sure how realistic that is with the region in its current form. Lastly, this is a region of low institutional trust. We can see this in the vaccine hesitancy being reported across the region. This is an unsustainable state of affairs, as we saw just a decade ago with the Arab Spring and the start of the Syrian civil war. There is significant evidence that rebuilding health infrastructure that actually serves the needs of local populations is a way to build that trust. So I think for those of us outside the region at the moment, how can we leverage this evidence to encourage the region to shift from a national security focus that is dependent on military prowess and an economic focus that is almost entirely dependent on unsustainable oil reserves to one where human security is placed at the center of the state apparatus? These are admittedly tough questions with no easy answer. And this is, of course, not a region that does well with ambiguity. For the sake of the tens of millions of people living across the region, I hope they are able to attain the good governance they need and deserve, and not just for COVID, but the many known and unknown challenges ahead. Thank you.
Thanks very much, Dr. Asi. I think what you highlight is obviously what we've seen in general, this kind of global failure. There was a lot of warm words, certainly here in the UK last spring, about a global response and international response to a global crisis. And, we've seen that utterly. Mostly the conflict or the contrast between different regions, but the Middle East is its own kind of patchwork of differences, as you've highlighted. So, I mean, how we tackle this on a global or regional level is the challenge we face. We're a year in from knowing that vaccines were coming, and our distribution of them is absolutely